Uh, Welcome to NMBF Coffee Chats. Once again, it's just the place that we gather once, twice a week to discuss topics and issues that are very important for our living as members of a community and also as for members of the society. NMBF Coffee Chats is essentially a church-based Christian discussion forum, but then we also have topics where we invite friends of other faith, society, general society members. And today is one such topic because it's a topic on cancer, and cancer knows no religion, no barrier. It can come to if it can affect anyone. And today we have had cancer awareness lectures with Dr. Tabassum Barsawala earlier on different issues. But today we have Dr. Mathew to talk to us about prostate cancer. And just a quick introduction about Dr. Aju. I came to know him during a training with Pallium India on palliative care, and his lecture, his explanation on cancer was really, really very good. And we're very thankful that he's here with us today to speak on this topic. So, just a quick introduction. Dr. Aju Mathew is an American board certified medical oncologist and hermatologist in Kochi. He's currently working at the MOSC Medical College and the Ernakulam Medical Center. He's also a consultant at the Trivandrum Institute for Palliative Sciences, uh, a, WHO with Center for Palliative Medicine. Previously, he was an attending physician at the NCI designated Markey Cancer Center of the University of Kentucky. He was also the co-director of the Hermatology Stroke and Oncology Fellowship Training Program. After graduating in the medicine from the Government Medical College Trivandrum in Kerala, he has attended further training in Cambridge University in England, Karolinska Institute in Sweden, and University of Pittsburgh in internal medicine and fellowship in hermatology, stroke medical oncology. He has published in major high impact journals in the field of medicine. He has also received awards from the American Society of Clinical Oncology and American Association of Cancer Research for his scholarly work. Dr. Mathew is an ethics committee member of the American Society of Clinical Oncology and a working group member of the European Society of Medical Oncology. He is the founder of Meewal Care. He lives in Kerala in India. So welcome, Dr. Aju Mathew. It's a joy to connect with you after a long time. So over to you to lead us on this session on prostate cancer.
Thank you. One way I torture people who invite me for talks is by giving them a long list of things I've done, which includes places that I've worked and degrees that I've received, which aren't too much, but still it's complicated terminologies. So I find it very fascinating when I hear people talk about it, but it's fun. I enjoy it. Thank you, Abhijit, for the introduction, for the kind introduction. So it's a good, nice Friday evening. I guess everybody's completed their dinner plans and is just here for some lazy hearing, some lazy time. Take it easy, no serious stuff. But at the same time, let's do some interaction about health-related topics. Today, our topic of interest is men's health and prostate cancer. And as a prelude, I can say that one of the most commonest cancers in people across the world is prostate cancer. And unlike a lot of cancers, prostate cancer can happen only in men. That's because this gland called prostate is only there in men. Women don't have it. Prostate is an organ. It's a small gland that is in a man's body, very close to the urine bladder. Bladder is where we hold the urine. And from the urine bladder, the urine passes through a small tube called a ureter and is getting voided, okay? And during that passage through the ureter, it passes through the prostate. So the prostate gland sort of engulfs the last part of the urinary bladder, as well as the tube that passes through the bladder outside. So that is why a lot of the men have, when they have some problems related to the prostate, will present to the doctor with complaints of urination. The prostate gland produces a lot of proteins that are important for a man's health. But after a certain age, it is not really that important. So one may think, why do we need it? We can just take it out. Well, if it is that easy, it would have been better to take it out. But the problem is some vital organs are passing side by side to prostate gland or through around the prostate gland. So it's not easy to just operate and take it out preventively. So we want to keep it in the body as much as possible, unless you have any pathology. So that's about the prostate gland itself. Now, the prostate gland has a unique property. Prostate gland secretes a protein called prostate specific antigen, PSA. In some individuals, the PSA will be higher than some other individuals, even in a normal state. So not all persons need to have high levels of PSA or low levels of PSA. There could be variability between one person and another person. And that itself is one of the biggest challenge with screening for prostate cancer. That itself is one of the biggest challenge with diagnosing prostate cancer at an early stage. So now you understand where the prostate is kept in our body, in a human being, in a man's body. Now let's talk about what happens if you have trouble with the prostate. Now the prostate can get swollen with age, can get swollen with infection, can get swollen with cancer. Swollen as in it can get bigger with infection, with age, a normal age-related process, or with cancer. And in any of these conditions, because of age, because of an infection, or because of a malignancy, one of the commonest symptoms is urine trouble. What are the various urine symptoms that one can have in patients with enlarged prostate or swollen prostate? And one of the biggest symptoms is called lower urinary tract symptoms. Lower urinary tract symptoms, LUTS. For example, when somebody's prostate is enlarged, it presses on the urine tube and the man tries to pee out the urine, but because it's pressing, the urine doesn't go easily. It's called hesitancy. You hesitate before you start peeing. So a man could go to pee, and then they take a lot of time for the first pee to come out. It's called hesitancy. The other problem is incomplete evacuation. So you want to pee, some pee goes out, some urine goes out, and then some doesn't go out. Some remains in the bladder. That's a challenge. That's called residual urine, post-void residual urine. Another challenge is the stream. You know, when you open a pipe, the water goes smoothly. But if there is some block in the pipe, the water goes like a small thread. The same thing can happen with a man too. If the prostate is enlarged, the urine, when you try to pass urine, it goes like a small thready urine. Another problem is you may have to wake up several times in the night. Frequency. You may have to go multiple times. You don't void completely. You void incompletely. So you have to wake up multiple times to pass urine. So these are the various symptoms a man could have. And these symptoms are otherwise called, put it all together in one umbrella, called LUTS, your lower urinary tract symptom, or LUTS. So if a man has LUTS, lower urinary tract symptom, what should you do? You should go see a urologist. And the urologist will do an ultrasound scan, will put the finger inside through the rectum, because prostate gland is very close to the rectum. So if you put a finger inside the rectum and just feel upwards, you can feel the prostate gland. So if there is a lump, if there is a hard lump inside, you can feel like a stone-like thing in your finger. So the urologist will put a finger inside, will do an ultrasound, mainly to see if there is any hard lumps, mainly to see if there is any residual urine. Now, if there is any of these things, they will also do a prostate secretion antigen, PSA test. If any of this is abnormal, the doctor, the urologist, may decide to do a transrectal ultrasound, because prostate is very easily seen through the rectum. So they will put an ultrasound through the rectum and visualize the prostate gland. And then you can as well see whether there is a lump, or is it just a generalized swelling of the prostate because of an aging process. If there is a lump, then the doctor can do biopsy, put a needle through the rectum. It's not very painful. And then take pieces of it to put under the microscope and see if there is any cancer or if it is benign, non-cancer. Another better test nowadays, where you don't have to do this biopsy all the time, is to do an MRI scan. MRI scan is a magnetic scan. An MRI scan is very sensitive to identify any changes that can happen within the prostate. So once the doctor does these things and figures out whether the person has any of these problems, then you have to think about treatment. So if it is an age-related problem, then it's a problem of the prostate gland just swelling up and pressing the tube, urine tube. So then the urologist will say, I would like to do a TURP, transurethral resection of the prostate. So the urologist will put a small tube inside. And in layman's language, if there is a port, the Mumbai port will have a lot of sediments, sand coming inside. And then big ships can't approach. So what do? You dredge, clean up the sand and throw it away. Same thing. The urologist will go inside through the ureter. They will do some dredging. They will open it up. They will clean up the tube. So the prostate that is pressing like for instance, if it's this space is there, and if it's like pressing like this, the urologist go inside and like dredge it out, so that the space is back to larger. So the urine passes. Now this is done in patients who have LUTS, lower urinary tract symptom, because of an aging process. And that kind of a disease is otherwise called BPH, benign prostatic hyperplasia, BPH. That's benign. Don't worry. The doctor can also give you a pill that will help relax your muscles in the urine tube so that you can pass out the pee relatively easier. But if there is a cancer, if there is a tumor, if there is a mass, then the doctor will do a biopsy, will figure out the grade of the tumor, and then we'll make some recommendations. The remaining stuff that we do, whether if it's cancer, is based on further test. One such test is called a PET scan. A PET scan is done. Sometimes we do something called PSMA PET scan. That is a different type of PET scan specific for prostate cancer. Now that kind of a scan is done mainly to see if the prostate is cancer has traveled outside of the prostate into any other parts of the body, like in the liver, lungs, lymph node, bone, that kind of stuff. If the tumor has gone outside of the prostate gland and has gone into these organs, then there is no point operating the prostate and removing it because it's already spread. Then the doctor will refer you to somebody called a medical oncologist. That's something like someone like me. And I will give you two options to start with. You have to take an injection or you have to remove your testes. Why? This is very important to understand. Prostate cells love testosterone, the male hormone. And prostate cancer cells love it even more. So one way you can reduce the prostate cancer from growing is by cutting down the testosterone level. You can do it by two ways, either by removing the testis from where the testosterone is produced. It's a very easy surgery, removing the balls or the testis. It's very easy, relatively painless. You wouldn't know. And by removing it, no other harmful effect is there. You can have permanent reduction in your testosterone level. Don't worry, you don't become a woman suddenly. It's just that your testosterone level will drop. Nothing else will change. Nobody will know. Or if you don't want to do that surgery, then you have to do monthly injections or 3 monthly injections. So one of either of these options must be done. If you have prostate cancer that is spread outside of the prostate gland into other organs. Now, if the prostate cancer is not spread out of the prostate gland, then you have 3 options. If it's a low-grade tumor, you can just wait and watch. You can just do active surveillance. You don't have to always intervene. Because another fact about prostate cancer is a lot of the prostate cancers are very indolent, very low grade. It doesn't grow fast at all. For example, if I just pick 180-year-old men from the road and do prostate tests on them, almost 80 of them will have prostate cancer. And they wouldn't even know about it. Because out of that 80, almost 70 of them will never die because of the prostate cancer. Or 75 of them. They just die because of old age or a heart attack. But they incidentally have a cancer in the prostate. So this is why some prostate cancers, especially if it's low grade, you can just wait and watch. You don't have to intervene always. Some prostate cancer, especially if it's high grade, you have 2 options. You can do surgery. That's called prostatectomy, removing the prostate. Or you can do radiation therapy to the prostate. Both are equally good, but both have different side effects. Removing the prostate surgically can cut some nerves by chance. And then there is a rare risk for permanent urinary incontinence. That is, you are unable to control your urine flow. You end up with complete, permanent loss of urine control. So you'll have to walk around with a diaper. This is rare, but it is possible. Another group of individuals, you can remove the prostate, not surgically, but by doing radiation. So you do radiation therapy and basically destroy the prostate gland. So that's also an option. The side effect with that is because the rectum and the bladder are very close to the prostate gland, some collateral damage can happen in the rectum or the prostate. Sometimes you can get a stricture or pain or bleeding, but these are all temporary. It will all get better. So these are the various ways we can treat prostate cancer. If the prostate cancer is stage 4, that is, if it has gone to other parts of the body, there are different types of tablets one can take. After the tablets are exhausted, that is, the person has stopped responding to a tablet, you can do something called radiation therapy to the prostate cells that have spread outside of the body. It's called PRRT therapy. After all of this stops working, you can try chemotherapy. And after all of this stops working, unfortunately, a person can die because of prostate cancer. So although I do say that prostate cancer is easy to treat, it's not scary, but we do have some patients, unfortunately, who still die because of prostate cancer, because some types of prostate cancer are dangerous are fast growing and can create trouble for a person. So this is the overview of anatomy of prostate, the symptom that you can have when you have trouble with the prostate, what are the various types of troubles you can get in the prostate, what can you do if you have age-related trouble, what can you do if you get cancer-related trouble, how do you treat cancer of the prostate based on the grade, what sort of scan you should do, PET scan. If the cancer is gone outside of the prostate gland, how do you treat? If the prostate cancer is just remaining in the prostate gland itself, how do you treat? And what happens if a person has prostate cancer that is spread outside of the prostate, has stopped responding to all therapy? What happens to them? So we talked about all of these in the last 15 or 20 minutes. So that was a very rapid but quick eagle's eye overview of prostate cancer. Now I'll come to another important question that I often get. I told about how prostate gland secretes something called PSA, prostate specific antigen. It is a very easy test you can do in a blood. Can we do PSA test and identify cancer? The answer to that question is yes, we can, but not always. But the other problem with that question and the answer is that sometimes we may catch things in your body that may not need to be treated at all. Like I said, some cancers are indolent, slow. And then we find something and then we'll be forced to treat it because we found it. So it will create a lot of anxiety. It may create some side effects because of the treatment itself. So this is a highly contentious question. Should we do PSA test for healthy men who have no problems at all? And the answer to that question is no, we should not. Healthy men who have no LUTs, lower urinary tract symptoms, should not undergo regular PSA screening unless they have a hereditary reason for doing the test. Some people may have familial cancer. Some individuals may have prostate cancer because they have hereditary cause. Their father may have had prostate cancer. Their uncle may have had prostate cancer. In those kind of setting, if you test your father or the uncle or an older brother who had prostate cancer for a blood test for BRCA gene, and if their test is positive, then you should do the test for yourself. And if you have that same gene, then you should do regular PSA screening. So otherwise, PSA screening is completely unnecessary. So I think I will stop here with the initial introduction talk. It's a very straightforward, simple discussion. But at the same time, it's one cancer that can have a lot of questions for people in their mind. So we'll open the floor for questions. You can type your questions in the chat box if you feel like typing it, or you can just ask me right away. Usually when I sit with patients, I spend a lot of time answering these questions. So I'll take some time answering your questions.
Sure. Yeah. Doctor, do you happen to have any slides there to just show about some of things? If not, it's okay.
I don't, but I can just show you what a prostate gland looks like. I think it's important for people to see. So if you can just while people can ask some questions.
Yeah, you can share the screen. Are you sharing the screen?
Yeah, if you can enable me to share the screen.
Yeah, you can. It's open anyways. You can share the screen straight away. And we'll have the question answer also starting in after you finish. In the meanwhile, our friends could drop their questions on the chat.
Yeah, I hope
if you want to ask, we can see as well. Yeah.
Okay. Great. Okay. So this is a bladder that you can see. That's the prostate gland. And that's the urine tube called urethra.
Okay.
Let me find you another different picture. So again, this is when you have a tumor inside and it presses on the prostate.
Oh,
And so this is another way. This is the penis. This is the scrotum with the testis. This is the rectum. So the doctor can do an ultrasound, go right
okay.
close to the prostate and see the prostate, and then do a
Okay.
needle biopsy. So it's very easy
Oh,
by doing this.
okay.
And so another way to look at it is, let's see, anatomy. If there are any questions, please type in the chat box.
Yes, yes.
So this is another view of the pelvis and the prostate inside the pelvis. Pelvis is the hip inside the
Okay.
hip. All right.
Yeah.
This is another view in an MRI. That's the urine bladder. That's the bone in front of your hip. And that's the rectum. And that's the prostate. So you see how easy is it to do test through the rectum. That is how we attempt to biopsy it. And sometimes when the prostate is enlarged, it can cause trouble with the bladder. It can press on the rectum and create trouble.
Right, right.